Welcome to the Vintage Times, a program for older persons. On our program today, we will talk about rehabilitation services for older persons who suffer from disabilities and physical impairments due to illness or injuries. We will meet the physician who specializes in geriatric rehabilitation. That may include joint pain, joint replacement, gait and balance problems, bone fractures, and much more. This discipline is called physiatry. And with me is Dr. Syed Zafar, who is a physiatrist.
Hello,
and
Hannah.
Thank you for joining us today. Can you please explain your profession to us?
Physical medicine and rehabilitation, Hannah, is a quality of life specialty. It was born out of the need for our injured veterans coming back from World War II to rehabilitate those individuals back to the society.
Okay.
Over the years, the specialty has evolved to a point where the advances have included both in the physical medicine and rehabilitation side. The specialty mainly involves treating, managing, and rehabilitating individuals with any variety of injuries and illnesses.
So how does your profession differ from other medical professions?
As a physiatrist, we do have advanced training in physical medicine rehabilitation.
Okay.
And as physiatrists, our training really focuses on holistic care of individuals with the goal of improving the quality of life of individuals.
Okay. We hear a lot about physical therapists, occupational therapists who help people with disabilities. How does your profession relate to them?
As physiatrists, we work very closely with physical and occupational therapists and speech therapists to devise a program, a rehabilitation program for individuals who might be suffering from either traumatic brain injury, spinal cord injury, multiple sclerosis, head injuries. So we work very closely with therapists. The therapists do the hands-on work in terms of rehabilitation, and we help to do the prescription on the appropriate amount of the appropriate therapies that are needed for each patient.
So you're really the first person to go to, and then you will talk to the physical therapists and occupational therapists and guide them. And
the way it works, Hannah, is that we see the patient as a team, and we discuss the input that each individual has on the patient. Then I do a thorough evaluation on what the patient's rehabilitation needs are, convey it to the team, make sure we're on the same platform before devise and introduce the program to the patient.
who is on your team? What's the team?
In a hospital setting where a physiatrist works with a variety of other specialists, including physical and occupational therapy, we have speech therapy, we have a medical psychologist, we have neuropsychologists, we have social workers, we have case managers, we have wound care specialists, and we have recreational therapists.
I can see where you have to work together.
That is correct.
Yeah. Can you describe some common conditions you treat?
In my office, the outpatient office, I see quite a few patients who come in for joint pains, low back pain from a variety of reasons, muscle weakness, neuropathy, gait imbalance. There will be patients who come in for pain management, and that's quite a big part of my practice, and pain from a variety of reasons, both musculoskeletal, spine, or nerve and muscle related.
What is pain management? What do you do?
Well, in the pain management program, we're first trying to determine as physiatrists what is the pain generator, or what are the different pain generators. And then it's very important, vital to determine if there are any other issues that might be exacerbating a patient's pain. That might include psychosocial, psychiatric, issues that might be exacerbating patient's pain.
So
we really like to have a holistic approach towards pain management.
Yeah. So you treat the whole person. You look at their physical ailment, you look at their psychological needs.
That is correct.
Right?
That is correct. A thorough evaluation is done first. A good history is taken to determine the chronicity of the pain and the intensity, as well as the pain generators. Then a thorough history is taken in terms of what are the psychological and mental issues that might be involved or exacerbating the patient's pain. Thereafter, patients explained in very simple terms where the pain might be coming from, what are the different options, and we really like to give options in physiatry. So what are the different options for their pain management, and what are the outcomes to be expected?
Okay, so how does the rehab, you teach them how to do rehabilitation, how does it help them? How does it improve their functions?
The rehabilitation can help patients depending on what they're coming in for in terms of their rehab needs. There might be a patient who comes in the hospital, has had a total hip replacement surgery, and now needs rehabilitation before he or she can go back home. And the way that rehab helps is, number one, to improve pain management. Number two, it can also help to improve the flexibility of the joint, to improve muscle strength, to improve gait stability, to improve endurance, to go up and down, to be able to go up and down stairs. That's the hospital setting.
Right.
If you come in an outpatient setting, in an office, the rehab helps in different ways in terms of trying to get the individual back to what they like to do. It could be in the form of sports, it could be in the form of the regular work they do, it could be in the form of recreational activity, or just getting back home.
Yeah, very important. People want to be able to return to activities they've done before. So there is hope. It probably takes a little while and some discipline to work on rehab.
That is correct. It does take a while, and people need to realize that there are options out there. It just does take some time, depending on what the condition is.
You mentioned before, we talked about mental health. Is that an important part of the whole process? Do people get depressed or discouraged?
That's a very good question, Hannah. Depression or any form of mental illness plays a very big part in terms of the progress of the patient. It also affects the optimal outcomes of each individual undergoing rehabilitation. So it's very important at the onset to determine what that psychiatric problem might be. It could be in the form of depression, anxiety, and treat it because that will be a significant hindrance to the progress of each patient.
Yeah, so important. That means you treat the whole person.
That is correct.
Now, one of your goals is to treat people without surgery. Is that right?
That is correct.
Correct. You're not a surgeon, but what if a person has orthopedic surgery? Do you help them afterwards?
Yes, we do. We are routinely called in either in the hospital or in the outpatient setting to evaluate patients who have had surgery, and that could be in the form of joint replacements or fractures or general surgery. The way the way a physiatrist has a role is to first determine what the rehabilitation needs are, determine the impairments, and determine the disabilities that might arise as a result of the impairments. And then we also look at return to community status. What is the goal of the patient here?
Good.
Are they planning to go home, or is it something where they're not able to take care of themselves at home? They might need to go to an assisted living place or a nursing home. And according to that information, we devise a rehabilitation plan with the team. And as I mentioned, the whole team plays a big role in rehabilitation.
Yeah, good. So you treat patients in different places. Where do you treat them?
As physiatrists, we treat patients in the outpatient setting, at the acute hospital setting, where there might be acute rehabilitation units or subacute rehabilitation units.
Okay.
And we also treat them at skilled nursing facilities and assisted living places.
Okay. And can I just walk into your office and say, I have a pain, can I just walk in?
Usually what happens is a primary care physician provides a referral to the patient. Patients can on themselves walk in as well if they know about the physician and what the physician has to offer. But routinely we have primary care physicians doing that referral.
Okay, sometimes it's confusing who you go to with a certain problem. So it's good to go to your primary physician, right? And he will refer you.
That is correct. That is correct. It's always good to have one-point physician who is trying to coordinate your care. For primary care, it is that your primary physician. Once you come to a rehabilitation physician, he may or may not be your primary physician in terms of coordinating your rehabilitation.
Yeah, right. Good. Can you walk us through what happens when I come to your office? What's the procedure?
Sure. Once you come to office, we all smile. so everyone, the front desk does that, and it's first we go through the registration process, which really is also to determine why you're there, what's been done so far. So there's a form that you fill out that really spells out what is the need for you to be having that consultation, what's been done for you so far. What medications you've taken, what procedures have been done in the past, and what rehabilitation you received so far. After that, the patient's taken into in the room, examining room, where I personally will come in and review the entire history and ask questions, and then do a thorough physical examination. After the examination is done, I spend quite a bit of time sitting with the patient to let them know what my feelings are in terms of what's going on, what are the needs, if it's pain management, what are the pain generators, if it's a consultation for frequent falls, what is the reason an individual has been falling. I will talk about possible diagnostic tests that may or may not need to be done, and what is the reason for those tests, what to expect during those tests. And then I will talk about different therapy options or therapeutic options for that patient, and discuss also what to expect with each therapeutic option.
This is so important. I wanted to ask you how important it is to have a good relationship. I, as a patient, come in and I'm in pain, and I'm a little confused. I don't really know what to expect. Do you have some advice on how to have a good relationship? What should the patient do, or how should we prepare? How should the doctor respond?
I think having a good physician-patient relationship is an absolute essential for good patient outcomes. I think it's very important for patients to realize that they're where they're going and for what services they'll be going in terms of a physician referral. It's always good to do some research beforehand on who's this physician, what's the experience this physician has had, what's the training, what possibly he or she can offer for me. Once the patient is with the physician, I think it's very important for the physician to make the patient feel at ease in terms of what is going on, because a lot of times it's very overwhelming.
Yes.
And they've been through several doctors, and here there's one more doctor that they leave. And so it's important for them to say, well, the reason why they're here, because obviously the doctor needs to introduce him or herself, talk a little bit about their specialty, and talk about how they could help the patient. And then it's very important for them to take some time to talk about the different things that they have to offer, how they could help the patient, what are the benefits, and it's very important to also talk about in very clear terms what are the risks and complications of what therapies that there are. Because I think it's very important for the patients to be educated on what to expect for good outcomes.
Right. So should I write things down before and during?
I think it's very important when a physician is talking to a patient and explaining things is to advise the patient to repeat what's been said.
Good.
So that the physician is clear that the message has been communicated the right way. Also, it's also important to have patients either jot down points write down points to make sure that they don't forget, and they can always review those points. If a patient is not able to communicate, it's always good to have a family member there who can either explain to the patient or make sure that the patient is able to follow those.
So it's good to prepare in advance, as you said, study up on the topic, write your questions beforehand, write the answers during the session.
Most certainly.
Repeat what the doctor says. And if I still have a question when I come home.
I think it's very important for the physician to have very clear channels of communication and let the patient know that they can call the physician or call the answering service. The physician is not available. If they have any questions, and the physician should be able to get back to the patient within 24 hours. Or within an hour if it's an emergency. And also, I usually like to give instructions, written instructions to each patient before they leave. Yes. So they have those, and if they have any questions, even after they've read those instructions, they're always free to call my office.
So it's a good idea. Ask for written instructions.
That is correct.
And repeat, ask, and call back if you have further questions.
Absolutely.
Now, I go through physical therapy or whatever therapy for quite a while, then it stops. How important is it to continue after I don't have to come to your office anymore, get a physical therapist?
Sure. I think continuum of care is very important in rehabilitation medicine. If we've offered a prescription for therapy program, and like you said, if a patient finishes physical therapy and now does not know what to do, I think it's very important to clearly let the patient know what's going to happen next. And that next might be either following up with the physiatrist or the primary care physician. It's also important for the physiatrist to do a follow-up evaluation to see whether the patient has improved or has there been a regression. Are instructions being followed for the home exercise program as well? And if we feel that there has been a default in terms of how much a patient can do, there are always options to get the patient back into some other form of therapy. And that might be an outpatient therapy, or it might be skill therapy.
So you do that, you follow the patient even after the official treatment.
That is correct. It is very important for physiatrists to follow the patient after the therapy has been done to determine how they've done and then make further recommendations on what needs to be done next.
Okay, now we talked about what happens when I come to you as a result of an injury. Are there ways I can work to prevent injuries and physical impairments?
I think it's very important for our seniors to realize that preventative rehabilitation or preventative therapies or preventative exercises, I should say, are very important. They help with muscle strength and muscle toning. They help with bone strength. They help with balance. They help with coordination. They help significantly with your memory. So in order to be able to prevent any impairments related to weakness, instability, falls, memory impairments, I think it's vitally important that a program be devised for each individual, and it's usually custom because each individual might have their own requirements. They might have certain comorbidities that they are suffering from, which needs to be taken into account while they're doing the fitness. So I usually devise a fitness program for individuals so that they can maintain what they already have and prevent further injuries or disease.
We hear so very much about the importance of exercise, of fitness programs. How do we motivate people to do it and to keep doing it? Do you have any advice? No.
I think it's not so much of a motivation than it's letting people know that when you start exercise, the exercise helps not just in the long run, but it helps in the short term as well. And so I think it's absolutely essential that we talk to patients and let them know how the exercise is going to help them and what are the different ways they can do it. It's not always going out and hitting the gym. It's not always setting the alarm to get up. It's about incrementally increasing very simple exercise that can do at home, right. and sticking to it. Motivation is a big factor, and so different ways we let patients know how to keep motivated. Yeah. Usually, most of the time it helps, but sometimes it's challenging. But I think that the most important thing is to educate the patients on not just what to do, but also how much of this benefit they're going to receive, right. Not just in the long run, but also in the immediate terms.
Very important, very important. Now, because physiatry is still an unknown to many of us, can you please repeat again what you do and how important it is to work through your offices?
Well, what physiatrists are trained in, we are not surgeons, so we manage every non-surgical aspect of illness or injury in order to get the individual back to their pre-morbid status or their functioning status. So, and our role is to treat pain. Our role is to treat muscle weakness. Our role is to treat gait abnormalities, gait imbalance. And also, one of the areas of our specialty is neuromuscular disease management and diagnosis. So there's a special test called electrodiagnosis, or EMG, which we will use as a tool to determine whether an individual has a muscle or nerve disease. Okay. As a physiatrist, it's very important for us to let the individual know that there are certain programs that they can really benefit from. And we have different programs that we can offer, but more importantly, we also offer, a lot of physiatrists will offer complementary and alternative medicine as well. Okay. So it's important to let the individual or the patient know that it's not just a regular session that you're having in terms of whether you also have choices, and you can also get massage for this, you can get acupuncture, you can get naturopathy, you can get a variety of other alternative therapies that can help the individual. And you'd be surprised, a lot of times a patient will come in to see me with a lot of significant pain, and I talk about different options, spinal injections being one, medications, oral medications being, and then I also talk about alternative therapies. And a lot of patients say, "Doc, I really want to try acupuncture." Right. And we like to respect that, because there is a role of acupuncture in pain management. Right.
Well, that's important. You offer choices. You patients gear it to their own needs and wishes and philosophy. So
that is correct.
It's really, you offer the whole gamut.
That is correct.
Very, very important. Is there anything else that you would like to add that is important?
Well, Hannah, with the advances of medicine, I think there's so many different therapies and treatments available. My suggestion to seniors is to kind of look at, and research what's going around, and more likely than not, they'll find a remedy or treatment for their disability or impairment.
Okay, and look up the term physiatry. Does it come from the word physical therapy, physiatry?
I believe it comes from the term physiotherapy.
Physiotherapy, so you know.
That's what doctors were called initially when the specialty was not quite approved in the early 1940s.
Okay. Well, thank you very, very much. This was very, very helpful. And
thanks for having me.
You're welcome. And thank you for joining us today. We hope that this was helpful for you to learn about the field of physiatry. If you would like to call Dr. Zaffer or look it up, it's a very, very important new field that helps with various pains, injuries, and physical conditions. If you'd like to call Dr. Zaffer, he's right in our community at 630-873-5425. And thank you again for joining us today.